We'll have we'll be getting started as we're getting people on there. So we have Member Elsasser and Member Renault who will be online. Do I have a motion to allow them to come in remotely? Brandy, and a second from Linda. Yeah, we're doing this online, right? Any comments?
Hello.
If not, vote.
Hello? Hello?
Hi, Brian, just a second. We're waiting for all the votes to come in to allow you and Rob to
okay.
come on.
I'm sorry. I didn't hear anything, so I just thought we had lost the connection.
It looks like that motion has passed. So welcome, Rob, and welcome, Brian.
Thank you.
The next item is the approval of the April 22nd minutes. Do we have a motion for that from Ms. Duncan? Second? Sharon? Ms. Williams? Any comments, corrections, or additions to the minutes? If not, please vote.
I vote aye.
Mr. Elsasser is driving, so we do not want him pushing buttons right now. Motion carries. Next, we have our informational items, starting with the Board of Health. I see Ms. Hendrickson is here.
Yeah. Good afternoon. In your packet are two of our most recent board meetings, but I think when we submit these in our timelines, we've had since then another Board of Health meeting. Just to provide a little bit of update in terms of our program areas, some of our bigger projects. This week, we'll be hosting the last of our 3 stakeholder and community partner meetings to gain input in the scoring of our health priorities. As a reminder, local health departments are required to do a routine assessment of your community and do improvement planning. And we align with our hospital systems and our neighboring counties to do this in collaboration. It just allows us to utilize our resources more effectively. And we've been doing this since 2016. And so right now we are in the process of selecting our health priorities, and then we will develop an improvement plan that will go in effect for 3 years starting in January 1 of 2026. And so I believe a lot of you have already attended some of these or are aware of them, but again, our last one will be this week on the 5th. Those scores, along with our neighboring counties and our hospitals, will be consolidated together, and we'll have one aggregate score for what we will focus on. We're in the middle of grants. Again, health department being primarily grant funded. We are now working through all of our grant applications from the state and our federal pass-through dollars as well. Currently, we have received all of our current grants with the exception of those related to our emergency management and preparedness program. Jason Marks is working right now with the fire department on their accreditation process, and so will not be able to attend today, but kind of in coordination with his own update. We do believe that one of the state grants, our FEP grant, will be coming through our Public Health Emergency Preparedness Program. We expect cuts for our emergency management grants and our City Readiness Initiative grants. As a reminder, our EMA grant, our Emergency Management Grant, we worked with the Sheriff's Department in 2018 and adopted the county EMA, and then in 2022, we actually consolidated the city. So previously, before we came into play, there was 3 different entities working on emergency preparedness and management. And then through our process and partnerships, we've been able to consolidate that into one. So I've already touched base with the county administrator as well as the city manager about what that impact of the EMA funding would be, and potentially how the city and the county can help support while we wait for a little bit better understanding of where that will land. And then in terms of our facilities, we are also, going back to the grants, we're also working on our FY26 budget process. I know for us it's a little bit different because our grants dictate so much of that. But a lot of the work that we've done in planning for our new infrastructure has allowed us to start seeing that in our grants. So our centralized workforce, kind of consolidating of services and leadership, that's all kind of been playing into effect. So we're very excited about that. And then the other thing about our facilities is we've been working through some climate control issues. Our facilities management superintendent, Brian Johnson, has done a wonderful job, and I would be remiss if I did not acknowledge Terry Ruland, who's just been a great advocate. So we've been working through that, and we've had good partners that have been very patient and understanding, and so we do appreciate them as well. With that, I'm more than happy to answer any questions.
The beauties of a new building, until you stretch its temperature, then we don't know how well it's going to work. Any questions for Monica? I'm seeing none.
Do you want me to just do the EMA update?
Yeah, just do the EMA, yep.
EMA, Jason's report is in the packet as well for May. I would just want to also highlight one of the big things that Jason has been working on, has been working with a lot of our other first responding entities in terms of their services, accreditations, and their processes. And so while we are monitoring this grant work, Jason continues to, again, focus on that. He is also bringing together individuals to start looking at our outdoor warning systems. They are starting to age, and it will be a large-scale project. And so we do think this project is still a few years out, but part of it will be similar to the building, really working through the data and understanding kind of what those impacts are. So those are 2 things that he has also been working on. And then lastly, we've been working with a lot of our infectious disease partners at the state and locally just to prepare for various health issues coming into the travel season. We've seen some of our neighboring states and communities look at measles. And so working with our school districts and our ROE on back to school and the status of vaccination rates, but then additionally working with our sanitary district on potentially using surveillance that we've done for respiratory, also for measles. And so we're seeing if that would be potential as well.
Do we have any known measles cases yet in the county?
No.
Maybe?
I say that because as soon as you say it out into the universe, you get nervous. But
It's like saying it's too quiet, right?
No, but what we have seen, though, is a lot of interest in the population. A lot of people seeing rashes and, making that step. Again, the biggest thing to do is get vaccinated. Most children will get their first vaccines between 12 to 15 months. And so making sure that children are getting vaccinated. And then additionally, if there are individuals that were born after, I believe it was 1957, or have received a vaccination and not know which one they have received, they should talk to their provider. They may be needing to get a booster or a second dose, depending on their age and when they got their vaccine, the type of vaccine, and of course, if they have their records.
All right, any questions? My hometown is the area of Texas that got really hit by this measles epidemic, so it's very sad. Ms. Groves Allison.
One quick question. Can you repeat the dates or the timeline in which somebody may need to see if they need a booster?
So I will actually send that. I sometimes get the reverse because I'm thinking about lead as well in my mind. But I believe if you were born before a certain date but got your first dose of vaccine after a certain date, there's a potential that you may not need it because measles exposure early on for people born prior to 1957 was very much kind of dominated the population and the impacts of that. But then when vaccinations were coming out, there was 2 types that were given. One of them is still actually effective. The other one requires a booster. And so I will actually send that to Scott to share out with the board members.
Thank you for that useful information. Was there anything on care and treatment that I missed? Okay. ROE, I see Dr. McKenna is here. One moment before Dr. McKenna goes, just a quick comment. If you did not hear, the Peoria Historical Society issued its Historical Preservation Award to the Peoria City County new Health and Human Services campus. Of course, it's a new building, so the historical preservation is for keeping it where it was located. And of course, our committee was very instrumental in helping decide whether it was going to stay in that location. We won a beautiful piece of art, which now Monica holds somewhere in the building, so in the new building. So I hope you guys get to see it. All right, Dr. McKenna.
Good afternoon. First, I want to thank everyone for their support. I know I couldn't come to the appointment. I'll talk a little bit about that in a moment. One thing that you won't see change between sort of Beth's vision and my vision moving forward is that every day is such a great honor, really, to serve the kids that we have here in the county, the educators, and our collective communities. And so I just wanted to thank everyone since I didn't get an opportunity to do that before. A couple items that were included in the packet. On the week that I was appointed, I was in Utah with the Department of Homeland Security doing a master trainer for behavior threat assessment and management. It's a selective group. In fact, I applied last year and didn't get in. Hawaii, which I was really frustrated with. So I picked the closest to Hawaii, which was Utah, and not a similar experience, I don't think. I've never been to Hawaii, but I don't think probably similar experience. Ideally, now I have access to these national level experts. The amount of information that they have because of the Department of Homeland Security that now I also get to use in helping Peoria County school districts. One thing you might want to consider as counties are also putting together their own behavior threat assessment and management teams for employees or citizens that might have some concerning behavior to try and head off any act of targeted violence. And I think just yesterday, obviously there was an act of targeted violence. And so anything that we can do to help support that, but I'm now in a position to also be able to have some trainings across the county and for our citizens or whatever might be needed from the board. The second item is the Arts and Education Spring Celebration concluded on the 16th, and you'll have the numbers there for 2025, and we had 68 schools, 4,113 students, 38 bands, 41 choirs, 10 orchestras, 22 art displays, and probably an average of 5 food trucks a day. I know that's not in the official statistics, but they're really important to how the whole day goes as far as having enough folks out there to feed everyone who is there as a participant or anybody who is there to watch. We did have our post event meeting with Caterpillar and with the Peoria Riverfront Museum, and they were elated. They maybe didn't know what they were getting themselves into because it was something new, and they loved the use of their outdoor space. They said it was how they envisioned their outdoor space is always being used, and so we were happy to be able to do that this year. Our alternative high school, the Peoria Regional Learning Center's last day was May 23rd. Our principal resigned. She took a job at Peoria Public Schools, but we've hired a new principal, Dr. Michelle Cruz, who currently works for us. She's the one that does adult ed out at the jail, doing GED work with the residents out there. The Preschool for All program had their end of the year parking lot party. So if you haven't seen 63-year-olds, 3 and 4-year-olds running around, it's something. And so that's at St. Paul Baptist. We have 5 of our preschools out there, and we're going to add 1 classroom next year. Our grant will support even an additional 6 classroom, which we're also excited about. I have just a couple items that weren't in there. One, we have Literacy Summit coming up on June 11th. at ICC's Peoria campus. Kwame Alexander is going to be the keynote speaker. He's an Emmy award-winning producer of The Crossover, which is a Disney Plus series, New York Times bestselling author, most recently a 2025 NAACP Emmy Award winner. And so happy to have him out for a big event supporting literacy. And then I know I had a conversation regarding Amy Smith, who is the new assistant regional superintendent. You think I would get that right? I've been in that role for 9 years. She couldn't make it today. She's at an Indiana Fever game, but she'll be here at our next meeting to introduce her to everyone. So she's, just as a background, she's been the director of professional learning in our organization for 3 years. So she's amazing. She's incredible. So that's all I have. And then if you have questions for me, and then we can turn it over for some of our truancy related updates.
Any questions for George? Mr. Ricker?
Just a quick question. Thanks for the update on the arts and education. That's always a great program. Any thought of changes for next year? Are you going to continue the riverfront location or potentially bring it back to the courthouse plaza, or that's to be determined?
I think to be determined right now. We just haven't had any conversations. We're trying to bask in the glory of, completing. It's a long haul to go through 5 weeks, especially for Dave Poles, who is in charge of it, and Mary Ellen Ulrich. I mean, it's a busy time. So we haven't really sat down yet to talk with anyone exactly what our plans are for next year.
Other questions? All right, so let's talk truancy, right?
Yes, ma'am. So the data that you have in front of you is from May 23rd. We just wrapped up our final weeks of school on May 30th with Peoria Public Schools. Some of our other county schools had finished before that. So I'm really excited to bring data to you at the next meeting because it will be all of our final data, and I'll be able to give you some really good numbers on what we did as a whole for the year. So I'm excited about that, and that is actually what our team is doing right now. They're getting all those final numbers together, so they're not happy with me because it's stressful. So, but we are working on that, and we're seeing some really good numbers. So I'm very excited to bring those numbers to you. I did want to share one of our success stories. This is from one of our county schools. I actually had the principal reach out to me. This student was referred. He was referred to us last year, and we really worked with him. But he was referred to us again in October of this year. And when he was referred to us in October, he was at 4% attendance. He had attended 2 out of the 48 days of school. So pretty extreme case. Since he had already been referred the year before, Angelo Parker, our tier 2 specialist, him and I we met with the parents at the home, tried to come up with some interventions there. Those weren't working. We went and held a truancy advisory board at the school. Since it was a county school, we kind of went to them instead of holding it at Crittenton. CPCO came just in case there were some special education needs. The school, the principal was there, the assistant principal, the counselor, and we kind of worked on a plan where he gradually just started. He went to first hour for like 2 weeks, and then he went to first and second hour for a couple of weeks. And so just kind of slowly transitioned him back into school. And so today I did his final data, and from October 23rd until the end of the school year, there were 126 days, and he attended 89 and a half of those. So he went from 4% at pre-referral to 71% at post-referral. So I was really happy with that, especially, last year he was pretty much at I think he was below 20% for the entire year. So I was really happy with that. I was glad that, we could get him into school, and now fingers crossed we can keep him going. This year he transitioned from the elementary to the middle, so that's always a tough year. And so I'm hoping, fingers crossed, we can keep him going in middle school. So, and the principal sent me an email just saying that he loves having our student support specialist, and that she's made a huge impact, and that over the past 2 years, he loves that we've been more present and more active in their school and helping their families. So we appreciate you for letting us be able to do that for our schools and our families. So, but again, I'll have some really good numbers for you at next meeting, and thank you.
Thank you so much. I believe Scott has a comment for us.
Madam Chair, just as it relates to the next agenda item, or next informational item, which is sustainability and resource conservation. So I'll hold back in case any committee members have questions about truancy.
Yeah, sorry about that. Is there any questions or comments on truancy? Ms. Williams.
So what are the plans for the summer? Are you going to continue to work with families, or, what's the plan?
So right now we are working on our data, finishing that up. We have several organizations that we're going to work with so that we can get out into the community to work with our families. So Family Corps, we are going to have a two small groups of our truancy students that are going to come to the wraparound, which is where we are based out of. And I think we're going to have between 15 and 20 students, and they're going to come down. A 3rd through 5th grade group is going to do Monday, Wednesday, and then a 6th through 8th grade group is going to do Tuesdays and Thursdays. They're going to work with Paul Burse, and it's only going to be male students. He's going to work with them on just like life skill things, like routines, getting up in the morning, getting ready. He's going to take them on field trips. He wants to do a Chiefs game. He wants to do swimming with them. So really just continuing the relationships that he's built with them. And then we're kind of hoping that if this goes well, that we can kind of continue to branch that out with some of our other students.
Any other questions or comments? Okay, now Scott has a comment.
All right. Thanks, Madam Chair. Just the update on sustainability and resource conservation. Becca had a death in the family, so she's not here today. This past weekend on Saturday, we had first household hazardous waste event of the year that was in the parking lot of Landmark here in Peoria. We had 400 slots available in terms of making a reservation off the website. We ended up taking those sold out, and we ended up taking about 450 cars or thereabouts. Don't have actual numbers yet on quantities of household hazardous waste collected by Illinois EPA's vendor. We'll get that here in the next couple of weeks and share that out once we do get it. There are 3 more household hazardous waste events scheduled for the year. The next one would be August 2nd at Expo Gardens. After that, September 13th at Three Sisters Park up in Chillicothe. And the last one, October 4th at Alpha Park in Bartonville. And as we get closer to those, Becca will put in the update, and we'll put on our social medias reminders for everyone. So happy to answer any questions, or at least try to.
Any questions? And I'm sorry to hear about Becky's family member. All right. I do not believe we have any resolutions, so I'll open it up for public comment. Seeing none, any miscellaneous? All right, we are adjourned.